Experts are learning new information about COVID-19, and there's still some confusion about symptoms and how some people don't even show any. Here to clear the air for us from the Kind Health Group is Dr. Georgine Nanos. Dr. Nanos, so good to talk with you tonight, as always.
Hi, Ginger. Great to talk with you as well.
All right, let's start off with the symptoms. Okay, so they mask the regular flu. You know, we've heard them run down the list, but some people don't get any symptoms whatsoever. Why is that?
It's just, we're all different. Our immune response is different to different viruses. It may be due to genetics, it may be due to our underlying health. There's still a lot we're learning about why some people are asymptomatic and why others, have full-blown symptoms. But a lot of healthy people who don't have any underlying health conditions are generally not going to experience the severe symptoms that will put you in the hospital and, will cause, potential severe complications and respiratory distress. And that is still very rare, although I know we've been hearing a lot about those cases. The vast majority of people who do get COVID, and we will see more cases, they will get better.
All right, so the routine symptoms, the fever, chills, the cough, the fatigue, the muscle and body aches, the headache. I hadn't seen this one before. The new loss of taste or smell, sore throat, runny nose, nausea, vomiting. But what are the extreme symptoms that if someone were dealing with, they need to have immediate medical attention?
Well, I'd say top of that list is going to be respiratory distress, shortness of breath. And we typically see that at about, 5 to 7 days into infection with this, you may have heard the cytokine storm where your body is just overwhelmed with trying to fight the infection. And then you get this acute respiratory distress syndrome, which causes significant shortness of breath. Again, not very common, but that is certainly the most worrisome complication. And, accompanying that would be any chest pain or pressure, any severe confusion. Those would be, much more worrying signs. If you've had severe nausea, vomiting, and diarrhea, and you haven't been able to hold anything down, you may be at risk for becoming severely dehydrated. So those are also worrisome signs to seek immediate medical attention for.
Dan is out at the beach and he ran into a few doctors, and one of the doctors said he recommended plumping up your cells to be basically not immune, but as healthy as they can be. And he recommended taking vitamin A and vitamin D. Do you agree with that?
Well, vitamin A and D are fortified in a lot of our current foods, especially a lot of the processed foods that people seem to eat these days. But hopefully we're all getting healthier through this COVID crisis. So my opinion is always that you can't really replace the benefit of eating whole fruits and vegetables. So the best we can do is really eat a whole food diet, focusing on fresh fruits or frozen fruits and vegetables, and really adding those into our diet as much as we can, and exercising as often as we can, ideally every day. That's the best we can do for our immune system.
Anything else aside from washing your hands? Because, I got to tell you, I know you're so key on washing hands. And from our early interviews, every time I'm washing my hands, Dr. Nanos is telling me this is the best thing I can do. Anything else that we should do to... Yeah, that's a good thing, though.
Well, the mask wearing is very, very important. And I really want to make this point. And I know, in the news these days, it seems to become a political partisan issue. And I really want to remind everybody out there that it is a public health issue. It should have nothing to do with politics. Wearing a mask, we now know, has been proven to reduce your risk of transmitting and catching COVID-19, and in some cases by 60%. So it is really important that if you can't maintain a distance of at least 6 feet from people around you, that you should really be wearing a mask. It has nothing to do with left, right, or center. It is all about public health and keeping each other safe and doing our part for our communities.
Always wise words from Dr. Nanos. I really appreciate it. Stay healthy, my friend.
Okay, you too. Take care, Ginger.
Thank you.